County Board of Supervisors to order, please. And I want to thank all of the supervisors for taking and utilizing the opportunity to utilize the WebEx, and those that were unable, call in. Thank you. We are in uncharted territory. It's not probably the way we wanted to have the last meeting of the county board of this session, but we will have another shot at it on Tuesday, and maybe we can get some of the additional bugs worked out. So we will start with the Pledge of Allegiance, and please remain standing because that will be followed by a moment of reflection. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. And I would like to request that everyone locate your mute buttons on your phones, and please unmute when you're requested to respond to either a roll call or a vote request, and then put your phone back on mute after you've responded or had the period of discussion. Again, when somebody is going to request to speak, there's several ways. We will try to recognize people in order, and I will recognize the person, the supervisor that is going to speak at the time. When they are recognized, they will be recognized to speak, and then when they're finished, I would request them to also put their mic or their phone back on mute. So with that, we will move on to the reading of the notice, please.
An educational meeting of the Marathon County Board of Supervisors will be held at the Marathon County Courthouse Assembly Room, 500 Forest Street in the city of Wausau at 7 p.m. on Thursday, March 19th, 2020, and the agenda was duly signed and posted.
Thank you. I would like to request that everybody that is, again, on the call in, put their phones on mute. Anybody that is here in the boardroom, put your phones on silent or vibrate. And we will proceed to roll call. And again, the clerk will call the roll. Unmute your phone, unmute your WebEx icon, respond, and then please place it back on mute. Thank you.
Beestrom.
Here.
Boots. Bovee.
Here.
Butke.
Here.
Christensen. Supervisor Christensen. Seiler.
Here.
Crosby.
Here.
Drabeck.
Here.
Durham.
Here.
Fifrick. Supervisor Fifrick. Gaber.
Here.
Gibbs.
Here.
Guild.
Here.
Gums. Supervisor Gums. Johnson.
Here.
Krause.
Here.
Longenhan.
Here.
Leahy.
Here.
Lowe.
Here.
Mask.
Here.
McEwen.
Here.
Miller.
Here.
Nutting. Oberbeck. Supervisor Oberbeck.
Here.
Opal.
Here.
Robinson.
Here.
Rosenberg.
Here.
Schaefer.
Here.
Schley.
Here.
Seefelt.
Here.
Soibert. Supervisor Soibert. Stark.
Here.
Tremelling.
Hybrid is here. Here. Here.
Vol.
Tremelling here.
I got you, Supervisor Tremelling. Thank you. Vol.
It's hybrid.
I got Soibert too. Thank you. Supervisor Vol, are you there? White.
Here. Here.
Zhang.
Here.
Zerini.
Here. Here.
Thank you. And I would like to recognize and acknowledge all of the visitors that are on the public channel. Again, we are in challenging times, folks, but with all of the efforts that are being made, we can and will succeed in not curing this, but we will contain and do the best that we can and moving forward. So we will start with the education presentations. Standing committee chairpersons or designees. Is any of the standing committee chairs or designees have a report for the board? Any of the standing committee chairs or the designees reports for the board? So we will move on to item number 8B, update on the county's coronavirus 19 preparation planning efforts. And we'll have the Health Department Director, Joan Toyer, here to give us a presentation. And please, no, we won't take any questions during the presentation because it will be probably just too disruptive. We will, at the end of the presentation, take questions, and we will try to do it as orderly as we can. Thank you. Yeah, and just so everyone's aware, right now, Jerry Klein, the CCIT director, is going to be putting all of the calls that have called in on mute, so you won't be able to speak at this point. Thank you.
Thank you, Chair. Good evening, everybody. COVID-19 has and continues. What? Okay. Can you hear me now?
Speak as loud as you can.
Here. Is that? Yeah, it is. Is that better? There you go. Okay, thank you. So good evening, everybody. As Chairman Kurt Gibbs indicated, here to provide you in terms of an update on what we're doing. So I'm going to just start out with COVID-19 has and continues to create social and economic disruptions and uncertainty in terms of our health as individuals, families, and our communities. Give me. Okay. Okay. What is being asked of? Yeah, this isn't working.
Dave, are you disconnected?
Okay. Well, we'll try again. We're going to start from the beginning. So COVID-19 has.
Are you dialed into, okay.
Okay. Yeah, this is not. No, it's not. Okay. I think we got it. Okay. Okay. COVID-19 has and will continue to create social, economic disruption and uncertainty for our health, the health of our individuals as well as families and communities. What is being asked of residents is not what many residents have experienced in their lifetime. That is collective sacrifice as a community, as a state, and as the United States. If you think back, the last time something of this magnitude was asked of us was back in the 1950s during the polio epidemic. The virus knows no zip code, and fear drives us as individuals to close in and turn away from each other. Our number one job as leaders is to manage fear. As leaders, we can manage fear by providing timely, accurate, and consistent information. Community leaders, you are in a critical role in managing that fear, communicating what residents must and can do to protect themselves, their families, and our communities. Our time together, I'm going to provide you with a situational update, share what public health with our community health partners are doing, what Marathon County government is doing, what you can do as county board supervisors and residents, as well as address questions you may have. How do we advance the slide?
Not able to, hey Jerry, her presentation can't.
It's locked.
Oh, that's not good. What's going on there? No, it's the PowerPoint.
Okay,
What's going on there?
now it's going. Okay.
You know what? Maybe it was just because there was a big logo or something. Go ahead.
Okay.
Sorry.
No, that's okay. So just to kind of give you an overview of where we're at as of today. COV, COVID-19, early on was called coronavirus novel. And the reason for that is it is a new virus. And with new viruses, little is known about how it transmits as well as its severity. And we have much still to learn about this virus. We do know that it seems that older adults and people who have severe underlying chronic medical conditions are more at risk for developing complications from this virus. We know that it spreads to other people when an infected person coughs or sneezes, or when someone touches an object with the virus on it and then touches their mouth, their nose, or their eyes. Just to give you a sense of where we're at in the United States, right now we have 54, actually it's jurisdictions, 50 states. And as of March 17th, when this slide was created this morning, we had 7,000 cases and 97 deaths. CDC this afternoon, later in the afternoon, updated it, and just to kind of give you how this, how cases continue to grow. As of later on this afternoon, we were at 10,442 cases and 150 deaths. We now have community transmission occurring in 25 of our states. And when I say community transmission, what that means is that people have tested positive, they have COVID-19, and it is unknown where they acquired it or how they've been exposed to it, which is concerning because then we have less handle on how to control it. Here in Wisconsin, again, data was updated as of 2 p.m., so what you see on your slide has changed. We now have a total of, where's my stuff? 150 cases in 21 counties. So you can see how that has changed in just a day. As of 2 p.m., when we do get the final counts in from the state, no case was reported in Marathon County. In Wisconsin, like in the United States, we are seeing community transmission occurring. And in the counties of Milwaukee, Dane, Brown, and Kenosha, that is occurring. So what that means is we have cases, and when we do our investigation, we cannot trace the source for the exposure. Key goals for the U.S. healthcare system in response to this are we want to reduce morbidity and mortality. So morbidity is things like hospitalization. Mortality is deaths. We want to minimize disease transmission. We want to protect our healthcare personnel who are on the front lines caring for folks. And more importantly, too, we want to make sure we preserve our healthcare system and the functioning of it. And as we continue to move forward, we are all keeping in mind, how can we reduce the burden of lost wages for people being impacted by this, our productivity as a county, as a state, as a nation, as well as the overall economic impact. I'm going to just review kind of the timeline, and I think what you're going to see is how this has really accelerated. Nationwide, on March 13th, President Trump declared a national emergency. On March 16th, CDC, our Centers for Disease Control, recommended canceling and postponing events that consisted of 50 or more people for the next 8 weeks. And on March 17th, President Trump issues guidelines to America. And those guidelines included things like what people can do in terms of their personal hand hygiene, staying home when sick, travel, as well as not participating in mass gatherings and other community events. In Wisconsin, our first case was reported in February 5th, and that was in Dane County. As of March 4th, testing has been made available here in Wisconsin through our state lab of hygiene and the City of Milwaukee Health Department's lab. On March 12th, the Governor Evers declares a public health emergency. Also on March 12th, our Department of Health Services makes a recommendation that there should be no gatherings of 250 or more against all non-essential travel in the United States where CDC deems community transmissions going on. On March 13th, our Secretary designate, again with the Department of Health Services, orders closures of private and public schools as of March 18th. And then with the anticipation of reopening in April 6th. 4 days later, the order was amended to basically state that schools will remain closed for the duration of this public health emergency. On March 16th, the Secretary designee orders prohibiting mass gatherings of 50 or more people. and that's to be in keeping with CDC's recommendations. And then on March 17th, the Secretary further orders no mass gatherings of 10 or more people. March 19th, yesterday, as of today, the Secretary of Department of Health Services ordered childcare settings to have no more than 10 staff persons at a time and no more than 50 children present at a time. I'm going to spend just a little bit of time giving you some background in terms of why are these measures being taken, so you have a better understanding of the actions that we are doing. First thing I want to show you is a chart here which plots out kind of how we look at pandemics. And there's two aspects to this. One scale on the left-hand side looks at how we measure how easily is a virus transmitted. On the other scale then, on the bottom, it looks at how severe it is. Again, I shared with you at this time, because it is a new virus, we don't know a lot about it. We don't know where we would plot this on this scale. To give you some perspective, 1918 pandemic, referred to as the Spanish flu, was severe, significant deaths here in the United States, 675,000, and it was easily transmitted. If you think then back to 2009, during the H1N pandemic, which many of us still can remember, you can see that there was a moderate in terms of ease of transmitting, but it was not as severe. At this time, we don't know where COVID-19 will fall, and so that is part of the reason why, that is the major reason why we're taking the actions we are at this time. This next chart really talks about why are we taking what may seem as aggressive measures in terms of closures of schools, closures of public events, closures of bars and restaurants. And it is about the peak. And so I'm asking people throughout our community, leaders, to start be able to roll off your tongue. What we are trying to do is slow the peak. What happens if we don't take the measures that we have in hand, which right now is containment and mitigation. We don't have a vaccine to prevent this. We have no specific treatment for treating people who have the virus. Our number one tool that we have in our toolbox is called mitigation containment. And what that means is we're restricting the likelihood of it being transmitted from person to person. So why is this so important? It's about two things. One is we are trying to avoid overloading the demands on our healthcare system, so things like our clinics and hospitals. When you think about it, clinics and hospitals are not built to handle the volume of patients we are seeing with a pandemic such as this. The other thing we also are wanting to do is we want to avoid overloading our public health system. Our local health departments don't have the infrastructure to follow up on a significant surge of cases. So if we overload our healthcare system, what's going to happen? It's going to result in delay in testing, delay in treatment, increased number of individuals that are going to be hospitalized, and resulting in deaths. Our hospitals, our clinic systems were built for day-to-day routine care. So if we do not control that curve, what's going to happen is our hospitals and our healthcare systems are not going to be able to treat things as heart attacks, strokes, broken arms, etc. The other thing we also are doing is trying to not overload our local health departments in being able to do case investigations and quarantines. If we are delayed in our response to be able to follow up with a case, and do that contact tracing, which I'll talk about in a few minutes, individuals then are not going to be quarantined to their home, and then there's likelihood of further spread. The other challenge we also have right now is we still are in the influenza season, and it still has not peaked. So this is one of the harder years we've had in terms of the impact of seasonal flu. So by carrying out containment and mitigation measures, in a sense, we're going to slow that peak. We're going to flatten that. And how we do that is basically by staying home when we're sick. We wash our hands. We engage in cough etiquette. We restrict travel. We close schools. We stop allowing community gatherings. And we close things like bars, restaurants. When studying back, when you look at the 1918 flu and history around that, why some communities were more successful than others in controlling the number of people that died, it was because they took more aggressive measures in terms of community mitigation. So we know that it does work. I'm going to just spend a few minutes just to kind of give you an overview of kind of the functions that are carried out in responding to a pandemic. The first one is that I want to focus on is surveillance, epidemiology, and laboratory activities. So in plain speak, what does that mean? For individuals being tested, a report is made by statute requirements to the local health department of jurisdiction within 1 working day. We then have, within that same working day, we need to start our follow-up, which consists of getting on the phone with that individual, and then we start asking a series of questions. We're going to find out when did the person start developing their symptoms, and then who were they around, how long they were around that person for the period of time that's considered they're infectious. For individuals who are employed, we will then also, so anybody that's a close contact in that case, we will then basically reach out to those close contacts and ask them to stay home for 14 days. If they are employed, we'll be contacting their employer and working with them to determine, along with that individual that is a case, to determine who within their workforce needs to be quarantined as well. And this process is called contact investigation. We're fortunate that this is something that Marathon County has experience in. When you think about it, we have usually 1 to 3 cases of TB every year here in Marathon County, and for the most part, how many people here know that we even have TB? Which means we've done our job. We've been able to, in a sense, control further spread, and we've done it in such a manner that the community doesn't even know that we're doing it, protecting the confidentiality and the identity of the individuals involved. The other thing I want to spend some time talking about, community mitigation, I just covered, so we'll skip down to that, is our healthcare system preparedness and response activities. Several years ago, at a national level and at a state level, regional coalitions were formed around preparing for public health events such as this. They're made up of our healthcare system partners, our local health departments, emergency management, long-term care facilities, and other significant partners. We're fortunate here for the North Central HERC, which is what it's called, standing for Health Emergency Readiness Coalition. Both myself and Phil sits on the board, and the purpose of it is really to look at how do we provide a coordinated response in the event we have a mass fatality, or in this case, things like the pandemic. It has created a system among our healthcare partners where we plan together, we exercise together, and it has definitely helped us prepare for what we are being faced with. The last thing I want to cover and just highlight is communication and public outreach. Given the unknown, uncertainty involved here, it is critical public health and our healthcare system partners provide timely, accurate, and consistent messages on what we know about the virus, what's being done, and what they can do to be safe. Here in Marathon County, public information, the Marathon County Health Department is taking the lead on that. Judy Burrows is a supervisor for our community health improvement team, is serving as our public information officer. She has basically mobilized public health, public information officers who are housed in our healthcare systems and other critical partner organizations. And the purpose behind that is to ensure that we are all saying the same thing, using credible resources, and are speaking in a unified voice. In addition, Marathon County's website, you'll notice now on the landing page, there's a coronavirus photo. If you click on that, it will drive you to a web page on the health department site where we are providing, again, credible information, linking you to CDC and the Department of Health Services, as well as providing fact sheets and specific information for the sectors that we are interfacing with. And lastly, we have launched a Facebook account that is exclusive to this as a way to reaching a broader audience, and also to address rumors that we are hearing in the community so people have accurate information. So with that, I'm going to hand it over to Lance to talk a little bit about what we're doing from the lens of Marathon County government, and then I will leave you, when we're done with that, talking a little bit about what you can do.
All right, thank you, Joan. As Joan started her presentation, I want to echo a couple of points. As also Chairman Gibbs referenced, this is unprecedented territory for all of us, and each and every day the situation is evolving. Given the nature of the situation we're in, Marathon County is taking the lead from the health department. The health department, particularly Joan, is providing direction with respect to the changes that we as local government need to implement. And again, those things are changing every day. County administration, along with Phil, our emergency management director, is then tasked with implementing those directives. So for over the last, it's slightly more than 10 days, we've had what I'll refer to as our COVID-19 response team meeting frequently to discuss issues as they arise. And really first and foremost, while Joan is taking on communication externally to our organization with all the organizations and entities and partners that she referenced, really it's administration working with emergency management and employee resources and others to frame those internal communications with staff, again, with the whole point in mind being that credible information source and dealing with uncertainty as it arises, because as Joan alluded to, this is going to impact every aspect of the work that we do. So that team, while it started perhaps small, it's now grown. We have Joan as the health officer, representative from administration, myself, emergency management, the sheriff's office, employee resources, corporation counsel, social services, and it's growing to finance. And I will echo one additional point. A very key part of that team has been CCIT and Jerry, his team. And I'll allude to this and make reference to it as we go forward in our presentation about the work we've done, the things we've done to change the nature of how we perform that work. But again, we're meeting, we're getting those situational updates just like each of you did today from Joan, and we're taking steps based on the most accurate information we have, and again, that changes every day. So let me walk you through some of the internal things we did to respond to that guidance that Joan was getting from federal and state partners that she was then passing on to us. We started with perhaps the most simple measure that we could take, and that's an important one that Joan talked about, that personal steps to mitigate risk. We enhanced our custodial practices. We've made some changes to the nature of those practices, disinfecting high-touch surfaces more frequently, door handles, light switches, elevator buttons, railings, and faucets. We implored staff with frequent messaging about the importance of washing your hands, demonstrating that cough etiquette and those other things that Joan talked about, all in a very important tool to prevent the further spread of COVID-19. We also took some really, I think, important steps, and Joan referenced steps being taken both and recommended both by the federal partners and state partners. Early on in this, we suspended all work-related non-essential travel. We also provided guidance to staff relative to personal travel, implementing a process whereby staff, if they are traveling, they are reporting that travel prior to the travel with their supervisor and or department head, and we provided them, notice on the various ways that we may restrict their access after that travel to the workplace. Because as Joan alluded to, social distancing and social isolation are important tools in that toolbox to mitigate further risk. So we put restriction guidance out to staff in most recently March 17th, and additional guidance is going to come out tomorrow that is going to be provided to staff, demonstrating to them what sort of travel is going to result or could possibly result in their restriction from the workplace. And the short answer is all non-essential travel. We are strongly urging all of our staff to not travel, whether that's within the state of Wisconsin or certainly outside the state. And if you are returning from another state or from another country, in all likelihood, you are going to be subject to a self-quarantine before you're allowed back to work. We also provided guidance to staff on how they should respond in the event they are exhibiting symptoms. Importantly, as Joan alluded to, staff are going to have questions and concerns, and this is going to impact them not only on a professional level, but also personally. So we took that into consideration, and we issued guidance relative to expansion of leave benefits. We made the determination to, given the length of time that an individual may be out of work based on the nature of COVID-19 or that they would be subject to a self-quarantine, we provided the opportunity for individual staff members that did not have sufficient leave balances to accommodate either of those situations. Effectively, they could borrow up to 80 hours of paid time off to accommodate those needs. Similarly, as Joan alluded to, one of the most significant issues that our staff are having to deal with relate to school closures and the childcare obligations that many of our staff have. So we provided that similar benefit relative to borrowing up to 80 hours of paid time off for purposes of childcare related to COVID-19 related closures. I'll offer one additional item relative to childcare. We, knowing that, again, this situation is going to persist longer perhaps than the 80 hours that we are initially providing, we are encouraging staff to identify those individual solutions to address those issues, and we evaluated how best to do that. And we evaluated whether to provide a sort of congregate care in partnership with local municipalities, or implementing a social media platform where we would allow individuals to discuss those potential solutions. Ultimately, through discussions with the chamber was already proceeding in that fashion, providing a mechanism through social media to pair childcare providers, whether they're local teachers or providers who are no longer able to work based on those closures that Joan alluded to pair those individuals with employees in need of childcare. We're going to be providing that link to that social media platform for staff, providing that information tomorrow. Also, we really, as I alluded to before, talked with department heads and encouraged them to really take a look at how we are doing the work that we're doing. and be open to doing that differently based on the principles of social isolation and social distancing. So we encourage departments to look at simple facility changes that they could make, signage changes to impress upon our guests and our staff the importance of responding to that social distancing, maintaining a 6-foot barrier between themselves and the public. We encourage staff and department heads to examine opportunities for flexible scheduling. And working with Jerry's team, we put together a telework policy, and again are encouraging department heads to really be open to the opportunity for individuals to work remotely if at all possible. And in a brief period of time, I can say that we substantially increased the number of people that are able to work from home. Relative to the building that some of us are in, and the rest of you participating remotely know we're in the courthouse, I can tell you that we held several meetings with judges and other court professional staff, district attorneys, defense attorneys, and others, law enforcement professionals, discussing how courthouse operations could be modified to, again, follow the principles of social isolation, social distancing, and to, again, only prioritize that most essential work. One piece of information that is extremely important for staff, and I want to impress upon it to all of you today, is that, again, to allay fears that, as Joan alluded to, this is going to have a substantial impact on not only our local economy, but nationally and globally. We wanted to allay those fears to staff by really making it a priority to protect stable income for all staff if at all possible. And we're doing that in a couple of ways, but one way that I wanted to highlight for you today is that we are developing a team to work to identify those departments where, based on the prioritization of essential work, we have staff capacity that has been freed up, that we can then reassign those staff to other areas, as opposed to asking them to take paid time off or unpaid leave or pursue some other options. So we have a team working on identifying those opportunities and putting those into action. And then the last thing that I'll briefly mention today is that we've really undertaken a very significant effort to double down on planning. So as Phil's in the back of the room, our emergency management director, we have emergency management plans for a great many type of various events. But we really did not have a strong plan in place relative to pandemic response. So we're in the process of updating that plan to go through all the various stages that we expect could come from this pandemic. We've circulated to department heads. We prepared a department continuity of operations template for departments. Essentially what it does is it calls for them to ask certain questions, again, around those ideas. How can we work differently, prioritizing our most essential work, and putting in place strategies to mitigate risk. It also causes departments to start to think about how do we return to work, return to normalcy when these restrictions are changed, or we're able to take back up some of that work that right now, quite frankly, we are not prioritizing. And those are important steps that we need to take. From a communication perspective, Joan alluded to this already. Based on the nature of this incident or this ongoing event, Joan is really the point of contact as the health officer for all those external entities. Our emergency operations plan calls for, based on the nature of the kind of the individual realms that exist within that plan, other departments to provide support, essential support functions as necessary. So again, administration is taking on internal communications. Communications with our health partners would go through Joan's office. Law enforcement communications would go through our sheriff's office. Our social services is in charge of coordinating any necessary medical or housing needs that may be put in place. But those command structures already exist, and as necessary, we are going to take on those additional communication functions. But I just want to end with one last point, and that is that The team that has been working on this, I cannot commend them enough for their work. This is new every day, and in fact, it's new every hour. We have rewritten policies for the last, I think, 3 days, and we continue to work on that, and we're doing our best, but I just want to commend everyone for the work that they've done thus far.
So in wrapping up, looking to you all in terms of what you can do. Stay home when you're sick. Encourage your family members to stay home when they're sick. Encourage your friends to stay home when they're sick. Wash your hands, cover your cough, keep your hands off your face. Limit your travels in Wisconsin and avoid traveling out of state and internationally. And I just shared, in a matter of days, how quickly the map of the United States can look in terms of the number of cases in a state, as well as whether or not community transmission is occurring, as well as here in Wisconsin. Connect residents with questions to United Way 211. United Way 211 is serving as, like they have in the past, and ramping up their services more to be the point of contact. I would say 2-3 weeks ago, we were getting inundated with phone calls, and they were residents with, valid concerns, but it was getting in our way of being able to do our work. Likewise, the hospitals were getting inundated, and state of Wisconsin is working with United Way and all 211s, whereby they're going to be receiving some additional funds, and they're being given scripts, and the idea is to take the pressure off of the healthcare system and local health departments who need to be fielding questions from people who are sick and who we are trying to contact for case investigation and monitoring. Marathon County Health Department, as I shared earlier, so I would just encourage you to Google Marathon County Health Department Facebook and share that with folks who basically get their news from Facebook. And then our website. We are continuing to encourage our business sector, our municipalities, schools, and other sectors to use that as their point for information. I ask you also to be informed and to use credible resources. The last thing we can afford to do is be contributing to the rumor mill. And so you have a plethora of resources, and I encourage you to use them. Help residents understand why we need to slow the peak. And I think this is particularly important for folks who were not around or were born, for myself, I was born in the 50s, and my parents, when I was growing up, talked about the Depression, they talked about World War II, and they talked about polio. So even though I didn't experience that, I experienced it through their eyes, and I carried that with me. We have a whole generation of people who have never experienced something that we are undertaking now. They have no understanding of the collective sacrifices that are being asked to make and why that's so important. And so if you can share your stories, if you're in that age bracket, that would be helpful. And also just talk about how we need to slow that peak so we can ensure that everybody who needs healthcare services will get healthcare services. Squash rumors. We spend time basically fielding what is typically a rumor, and it takes us away from doing the work that we need to do. I want to just assure everybody, if there's somebody that's being tested, we are notified and we're on it. If somebody's a case, we know about it, we're on it. If another county has a case and a person here is a close contact to it, we're notified, we're on it. So I just encourage you that when somebody says, I heard, please squash that rumor because it just creates unnecessary fear and inaccurate information. And lastly, if you could reinforce that Marathon County government and the health department, along with our partners, are doing our part to keep the public informed and safe. In closing, before we open it up for questions, I want to share a quote. I don't know how many of you have heard Dr. Anthony Fauci speak on national news. He's an impressive gentleman. He's the director of infectious disease at a national level. And what's impressive about him is he's 79 years old and he can run laps around me. So he's a great role model for some of us. But he has been basically sharing this quote, "There's no shame in overreacting. It is best to be in a position where we overreacted than to have underreacted." With that, I'm just going to leave you with stay safe and be good to each other.
Thank you, Joan. Now I would really like to thank all the efforts that administration and all of your staff have done to this part to help keep Marathon County safe and its residents. And so I'd now like to open it up to questions from supervisors. We're going to do it as orderly as we can. So is there any questions from supervisors?
Yes.
Yes, unmute your mic, and then I will recognize you, and then say your question, and then put your mic back on mute, please. So is there any questions?
Supervisor Rennie.
Sereni.
So I'll recognize Supervisor Zarini first.
Question is for Lance. I didn't hear any information about what we're doing at the jail to keep the inmates safe as well as our staff.
With respect to the jail, they were part of those meetings we had relative to courthouse operations. Excuse me. I can tell you that they are taking guidance from the Department of Corrections as well as Department of Health Services. We have effectively restricted individuals that we are accepting from other institutions to transport back for court for the express purpose of excuse me, maintaining security in the jail and trying to limit the potential for spread within the county facility. Oh, and excuse me, thank you, Scott. We have also implemented screening questions that we're asking of inmates as they are brought into the facility. If a local police department or law enforcement entity has arrested an individual and they take them to the jail, we have implemented a screening process through which we ask questions to evaluate risk. But again, I think the most important thing that the jail has done in cooperation with local law enforcement and the courts is really to limit the circumstances under which we are taking individuals into our jail. And we're actually taking steps to get more individuals out of the Marathon County Jail and supervise them in the community.
Okay, next question. Supervisor Nutting.
Tap it on the left side. It'll go from orange to green.
This microphone is on now. Okay, thank you. Have you had an update from our district attorney on the backlog of cases and whether or not they're able to pursue at this time? And are they indeed working with backlog of cases? Thank you.
I can tell you the district attorney was involved in those meetings that I referenced. I would say that of all of our departments, their department is probably the department that has taken the most advantage of our telework opportunities that we're offering. They are doing most of the work. I believe they only have, it's about a handful, 5 or so staff that are still in the office. the vast majority of support staff as well as attorneys are working remotely from home. They have made decisions about what cases to move forward in terms of charging. So in effect, additional cases are waiting to be charged based on the progression of COVID-19 and decisions made relative to the operation of the courts. But the current backlog, I would say, is certainly not being addressed in terms of workload, but we are taking less cases into the criminal justice system based on the circumstances we're dealing with.
Okay, next question. Any supervisor have a question?
I do. Supervisor Gaber.
Supervisor Gaber is recognized.
It's kind of a basic question, but I've been approached. What are the surfaces people are talking about? Is it clothes? Is it the hard surfaces? Second of all, I've been approached with in Wisconsin how many people are feeling better, and that's a big problem. A lot of people are very concerned, but they don't hear a lot of positive. If you're sick, they're kind of like feeling that, they should run to the funeral department. And I guess those are my questions.
Okay. In terms of surfaces, we're talking about hard surfaces, so things like tables, light switches, doorknobs, and really what it's a way to reduce risk. But I think when you think about the greatest risk is really person to person in terms of coughing, sneezing, and breathing in those air droplets. And that's why, hand washing is so important, because I can't count on the surface my hands are right on now, whether or not it's been clean, because Lance has just been here. And
I just used hand sanitizer.
and so this surface could be clean tonight, but we don't know how many hands are on it the following days. So what's really important is wash your hands and keep your hands off your face. And for some of us, we're learning all new behaviors, not in terms of washing hands, but keeping our hands off our face. In terms of people being sick, I'm not sure what the question is, but I do want to just emphasize part of our challenge right now is we still are in the middle of a seasonal flu. It's been a hard season. We still haven't peaked. And so I think our providers, our healthcare providers, are having to make some tough calls in terms of, does this look like seasonal flu? Luckily, we do have easily accessible ways of testing for seasonal flu to weed those out versus, has this person traveled, and are there other risks that would make one think this person might have COVID-19?
Joan, I do have a question. Do we know the length of contagiousness or length that a individual is contagious?
Yeah, good question. Anybody that followed the Dane County story, it was took, I think it was almost 20 days, don't quote me, to a month, whereby it was finally determined that the person was not able to transmit. Since then, because of the number of cases in the United States, we've learned a bit more. What we're thinking is the period of infectiousness is 3 days before the onset. So that's, if somebody comes with a case, that's where we would typically start. And then looking through 14 days is the period whereby somebody can, who's been exposed, could come down with signs and symptoms. And it's from 2 to 14. 14 is the onset. And then in terms of a case, we're looking at another 14 days out. So that's what we're...
Thank you. We have next, the chair will recognize Katie Rosenberg. She has a question.
Hi, thank you very much. I just wanted to give you a shout out for starting your Facebook page. I think it's really important. And more information right now is better than less. I'm just wondering what you have as far as a communication plan for some of this stuff to kind of dispel the rumors and all that kind of.
Yeah, actually, good question. One of the things I think is really important when Lance was talking about continuity of operations and what is considered essential services. In the health department, we've had to reprioritize what we do. We have a staff, I think, I'm trying to think, some positions weren't filled, so a staff of 40, maybe 38 full-time equivalents. When you think about what we all have to do, we can't task that to 5 full-time equivalent communicable disease nurses. So we have are starting to and will continue to shift, and I anticipate if this thing gets in full swing, we will be basically about 90 to 95% of staff will be retrained to support our efforts. In addition, we're going to be bringing on, we'll be looking at bringing on additional staff through agreements, whether that's with our school districts or other agencies who may have staff available. In terms of communication, we've been fortunate. We have a great team of public health educators who right now don't have a lot to do because, you know what, we can't have community meetings anymore. And so their skills in terms of facilitating, leading community groups on addressing our community health priorities is not occurring. Their efforts now have been switched to communicating to the public, and so we have a team of people who are basically kind of trolling what is happening, what are people talking about out in the Facebook world, and then basically multiple times during the day posting or responding to those rumors. In addition, we are fortunate to have a strong media presence in terms of TV and print, and Judy Burrows has been out in front communicating as well.
Thank you. Supervisor Overbeck?
Yes, I have a question regarding the 14-day isolation. We've went from 250 I guess, attendees down to 50, down to 10, shutting down our schools on early or late in the week and saying, well, they're going to shut on Wednesday and then we close them on Monday. Are we just putting off the fact that we should really be going to a 14-day quarantine like Italy did and doing it all at once? We still have retail open as far as non-essential retail, rather than grocery stores and drugstores. Are we just prolonging this? There's been all types of reports in the media about the fact that, and even the president stating that we should go to a 15-day, I guess, quarantine. Why? You know, it seems like we're always behind the 8 ball as far as acting on this.
Mm-hmm. Yeah.
Why isn't it being recommended that we be more proactive?
Yeah, good question. I think what we're trying to do is balance what is needed at a point in time. And that's hard to do because we can't forecast how quickly something will spread like this. Keeping in mind people's basic economics in terms of how do we support people, given many people are living on minimum wage, marginal incomes, and they don't have money put away. They are living from day to day. In terms of proactiveness, one thing I would call out, the state of Wisconsin has been very proactive. I don't know how many of you know, but Julie Wilms Van Dyke, who was the former health officer, is sitting in the deputy secretary chair. And she gets this. She understands the magnitude of what this means as well as what needs to happen. And we're fortunate to have her sitting in that chair because I am sure she is advising the secretary as well as the governor. But in Wisconsin, we have been a lot more proactive. The school closures, I think, is an example. We have been asking people to self-monitor who return from states where there's community transmission, and other states have not necessarily done that, and CDC doesn't even recommend that. So we've been much more aggressive. It is unfortunate, and I would just recognize, could we have done things differently as the United States, as a state? And I guess looking back, you can always find ways to improve, but I think what's really important now is we look forward, and we don't have time to go back and say, what if, what should have been? We need to go forward.
Okay, thank you. I just let all the supervisors know that are on the phone that we're getting questions from the people that are on the internet first, and then we're going to, but before I go back to a supervisor who has already been recognized, we're going to open it up to the people that are on the phone. So Supervisor Zhang is next.
Thank you, Mr. Chairman. The question I have is, how have we been enforcing the 10 people limit? I may have missed that, but I guess I was just kind of curious as to what we at the county have been doing to help enforce that 10 people policy.
Okay, the 10 people policy applies to the public sector. It doesn't apply to, what I do personally. Would I recommend that people keep in mind who they're socializing with and keeping their networks smaller? Yes, that would be helpful. So in terms of the public venue, I know, for example, we do licensing for hotels, motels, restaurants. And so we sent out it's called Constant Contact, alerting all our license holder of the rule. I know that yesterday in conversation when the COVID leadership team was meeting, Sheriff Parks was talking about how they were working with the city of Wausau to respond to establishments that they had noticed being open. So that is what we're doing on our part. I know municipalities, even before this rule, the 10 rule was in place, they were in contact with me in terms of what they should be doing with their spaces that they rent out. And with the 10-person rule, it became really easy. They just are not making them available. Here in the county, I know Jamie Polly has been in contact with Lance and ourselves, and shelters and other facilities are closed.
Okay, now we'll open it up to the individuals that are on the phone. Any questions from individuals that are on the phone? Again, going any, pardon me?
This is Supervisor. This is Supervisor Donna Krause.
Supervisor Krause is recognized.
Yes, I saw that community transmission is from this CDC said that it was in 18 states. Yet on the radio, I had heard that it was there were cases in all 50 states.
Mm-hmm.
So I guess this is to Joan.
Okay. So just to define the difference, there are cases in all 50 states and 54 of the jurisdictions within the United States. So when we say case, what it means is somebody's been tested and they're positive. They have COVID-19. When we talk about community transmission, what we're talking about is when we do our contact investigation, we're trying to determine the source. So was this person, did they just get back from Seattle? Okay, that's likely where they got it. So when we say there's community transmission, it means we don't know where the source is and or it's widespread. So if you look at the state, if you go on to the state of Wisconsin Department of Health Services and type in COVID, You will then go to the landing page. If you type on outbreak, if you click on outbreak, you'll get basically a listing of the counties as well. And in there, you'll see which counties there's community transmission, meaning they have not been able to pinpoint. Also, there's a map, and so at a state level, when they say it's widespread, it means there are cases occurring throughout the state versus just concentrated in a given part of a state.
Okay, next question from the callers. Anybody else on the call-in has a question for Joan?
Yeah, this is Supervisor Pfeifferich.
Supervisor Pfeifferich is recognized.
Thank you. I'm just trying to get a grasp on this, and there's been a lot of changes that have taken place in the last week now. Do we have any idea going forward? I know it's hard to predict this, but trying to prepare ourselves for the future, what is going to be the next shoe to fall? Is any indications on that, or any preparations that the county is making?
I think the challenge with this, it's a virus we don't know a lot about. We don't have a vaccine to prevent it. We don't have specific treatment for it. This could last months, and part of some of the factors, and I'm not a health infectious disease expert here, but some of the factors that will determine the course and the length is how severe is this. We are not going to get a better handle on that until we've had more cases and just give us more time in terms of what are the outcomes for those who have COVID-19. And it's hard to say, too, the efforts that are being put in place around social distancing is to really tap down that curve. And so at some point, if we're not seeing significant or new cases, will then these measures be lifted again? And then if we see cases occurring again, will they go into place again? We're in uncharted waters. All we know is that these measures do work, and that's our tool we have available right now.
Can I add one piece?
Sure.
Supervisor Pfeifferich, to your question about its potential impact on government, I'll address that from an operational side. That's the sole purpose, or one of the purposes, I should say, of the continuing operations plan that each of our departments are tasked with putting together. Again, that plan in and of itself calls for us to prioritize those essential services and identify which staff we truly would need to have present to deliver those services to the public. It calls for us to identify lines of succession in the event that key individuals are incapacitated due to COVID-19, and it calls for us to identify similar lines of delegation of authority in the event those individuals are incapacitated. Similarly, I'll indicate that I alluded to communication before internally. We've also been in close contact. We had a meeting yesterday, Joan and I attended virtually, a meeting with local municipalities talking about the opportunities we might have for maintenance of effort or memorandums of understanding relative to key services across those municipal borders. I know that the Sheriff's Office has been speaking with the City of Wausau Police Department as well as the Everest Metro Police Department to start to put together plans, again, in the event that we have significant workforce transmission of COVID-19 and we don't have the necessary staff in and of our own municipality to continue to operate. How can we do that through the collective staffing available in the community? Those are all things we're continuing to put in place at this point. We're having a meeting tomorrow with department heads to talk through the status of their individual department continuity of operations plan. So that's an ongoing effort, but I think it goes to the heart of your question. You know, how do we start to ready ourselves for what is to come?
Thank you. Any other questions? Any other questions? One last call. All right, I want to thank Joan, and I want to thank her staff. I want to thank administration and all of the employees of Marathon County for all of their efforts in addressing what we can address. And as the administrator appointee has clearly identified, is the things that we don't know change daily, and we react in some cases to those as that information comes available. And I encourage you as a supervisor to stay abreast. There's information on the Wisconsin Counties Association website, the CDC website, accurate information there, and there also is information available on the NACO website. And I am in various times addressing and watching webinars that are put on by NACO, National Counties Association, and also the Wisconsin Counties Association. So we will try to keep you apprised as things change. We'll move on to review and discussion of Tuesday meeting agenda items. Under item 9AA, the Board of Adjustment, that appointment has been pulled. We'll move on to item 9A22, and that is the county administrator. And I want to give the board, the rest of the board, a little bit of information as to what the task force did as far as its search and where we're at now. So on November 4th, the task force met to discuss the qualifications that we wanted in an administrator moving forward, and worked on the advertisement to discuss how we were going to advertise, where we were going to advertise, how we were going to do a national search for Marathon County's next administrator, and how long we were going to have that search open. It was discussed that we'd have that search open for a minimum of 2 months, so that we could do a national search, so that the advertisement would go out in not only the National Counties Association magazine and its publications, but also in the WCA, Wisconsin Counties Association magazine. It was closed in January, early part of January. The task force met. We received 17 applications. And the screening team was put together on the task force to review those 17 applications and requested some additional information on several. And one of those, some of the additional information that was done was we asked the Sheriff's Department to do an in-depth background check on some candidates. And we got those background checks back. The committee met then again on February 12th, reviewed the background checks on the applicants that we had requested background checks on, and we forwarded to the interview team 3 applications, and had the interview team then do in-depth interviews of those 3 applicants. It was over an hour-and-a-half interview with each of those applicants. The interview team comprised of myself, the vice chair. And I also want to thank the citizen members that we had. In this case, we had the president of NTC, Dr. Lori Ware, who assisted, along with a administrator from another county, Adam Payne from Sheboygan County, a well-respected administrator of over 20 years. He also assisted in the interviews. The interviews, again, took place. The interview panel then did its deliberation. It deliberated in depth and made a recommendation moving forward one name to the executive committee. The executive committee met on March 10th and heard all of the background that the task force did in looking at and recruiting for the administrator. And so you have before you now what the executive committee has recommended that this board consider, and that is to make Lance Leonard and appoint Lance Leonard as the next Marathon County Administrator. It was unanimous in not only the interview team, it was also unanimous in the executive committee team, and so it is for your consideration, and it is up for action on tonight's agenda. So I throw it out to the board for your consideration.
Cerny?
Supervisor Rosenberg is recognized.
Hi, thank you very much. I just want to give a shout out to you, Lance. You've been managing this whole thing with the pandemic. Ever since Brad left, it's been kind of crazy, so thank you. I also want to let everyone else know that I'm super proud that our next county administrator will be from District 1. We'll have some good representation no matter what. So I'm just very excited to vote in favor of this. Thank you very much for being up to this challenge.
Nominate first.
I would accept a motion before we have further discussion.
I would love to make that motion.
Supervisor Rosenberg with a motion to approve the next county administrator and the resolution appointing the executive committee to do the negotiations on the contract, and the second by Supervisor Nutting. Is there any further discussion?
Supervisor Schaefer.
Supervisor Schaefer is recognized.
I have no problem with the appointment, but I do have a problem with the executive committee negotiating the contract. I think it should, if it's negotiated by the executive committee, it should still go back to the full county board for approval. What you're doing right now, you're letting 20% of the total county board make a decision on a contract that I don't know what's going to be in the discharge clause. I don't know what's going to be in the release clause. And I don't want to, and I won't be sitting here 20 years from now, but I think the board has to realize if Lance leaves or if we decide we don't want him, what is it going to cost the taxpayers to have him leave? Otherwise, I have no problem with supporting Lance. So thank you.
Okay. Supervisor Zhang.
Thank you, Mr. Chairman. I too concur with Supervisor Schaefer. I have no opposition to the appointee, but I guess if you can clarify a little bit what attempts the recruitment task force and also the executive committee did in response to the letter that was sent to the from the Diversity Affairs Commission about keeping diversity and inclusion as part of the list of priorities during interviews. And I guess if you can clarify that up for me and just kind of go into details, that'll be greatly appreciated.
Part of what the task force did, they took the Diversity Affairs Commission's questions to heart, and in the questioning period that the task force did on the interviews, the in-person interviews, there was two questions that were directly related to diversity and those individuals, so it was clearly taken into consideration. Supervisor Zhang. Any other discussion? Any other discussion? There's a motion on the floor to approve the resolution in the packet and is seconded. Is there, one last time, is there any further discussion? Seeing none, I will ask the clerk to call the roll. Again, you'll be called out. Unmute your mic respond, and then please put your mic back on mute or phone. Thank you.
Beestrom.
Yes.
Boots.
Yes.
Bovee.
Yes.
Butke.
Aye.
Christensen. Supervisor Christensen. Seiler.
Aye.
Crosby.
Yes.
Drabeck.
Yes.
Durham.
Yes.
Pfeffrick. Supervisor Pfeffrick, are you still there? Gaber.
Yes.
Gibbs.
Aye.
Guild.
Aye.
Gums. Johnson. Supervisor Johnson? Krause. Supervisor Krause. Longenhan.
Yes.
Leahy.
Yes.
Lowe.
Yes.
Mask.
Yes.
McEwen.
Yes.
Miller.
Happy to vote yes.
Nutting.
Yes.
Oberbeck.
Aye.
Opal.
Aye.
Robinson.
Aye.
Rosenberg.
Yes.
Schaefer.
Aye.
Schley.
Aye.
Soibert.
Yes.
Seafelt.
Yes.
Stark.
Yes.
Tremelling.
Yes.
Vole. White.
Yes.
Zhang.
Yes.
Zerini. Supervisor Zerini?
Aye.
Supervisor Johnson?
Repeat that, please.
Supervisor Johnson.
Thank you.
Thank you.
Supervisor Krause? Supervisor Pfeffrick?
The motion passes unanimously. We have our next administrator, Lance Leonard. So we will move on to the next agenda item, and that is the Veteran Service Officer, and that appointment is also up for voter action tonight.
Appointing Jill Jeffroy, 1618 Lighthouse Lodge Road, Eagle River, to serve as Veteran Service Officer for Marathon County, effective March 23rd, 2020.
I would invite the administrator, Lance Leonard, to the podium. It is his appointment. He'll give us a brief background and information.
Thank you, Mr. Chair, and thank you again for the vote of confidence to be your next administrator. With that, I can provide some background information, as the chair alluded to, relative to the recruitment process for the County Veteran Service Officer position. We had in excess of 50 applicants for that position. The initial screening was done by Employee Resources. However, initial interviews were done by a panel comprised not only of staff, but also of county board members. On that initial county board member panel was the vice chairman of the county board. The panel recommended that further interviews be conducted of 3 highly qualified candidates. That further interview panel consisted of myself, representatives from the ADRC of Central Wisconsin. We had representatives from our Employee Resources Department, as well as county board representation. Supervisor Romy Wagner participated in those 3 interviews. As I alluded to before, the candidates were extremely well qualified. Backgrounds for each of those 3 candidates were extremely impressive. Ultimately, the determination was made by that final interview panel to proceed and move Ms. Jeffrey on for consideration by the full board. She comes to us with a very decorated military career, but also her career post-active service, where she was a helicopter pilot. But her post-service career is likewise decorated. She was most recently the Adjutant General at the Veterans Service Organization location in King, supervising in excess of 300 staff members. She is extremely devoted to the veterans community, and quite frankly, I'm extremely excited to have her begin serving in the Veteran Service Officer position. She will have large shoes to fill. Scott Berger was in that position. He was the longest serving Veteran Service Officer in the state of Wisconsin at the time of his most recent retirement. But if anyone can fill those shoes and serve the veterans of Marathon County well, I'm confident Ms. Jeffrey can do that.
Okay, I will take a motion from the floor. What is,
To approve.
please announce your name first. Motion to approve was by whom? Supervisor Schaefer, was that you that made the motion? When making the motion, please identify yourself. I don't have a name to the individual that makes the motion, so please identify yourself and move whatever motion you would wish to.
Stark, I move to approve.
Ying Zhong, second.
Supervisor Stark with a motion and Supervisor Zhang with the second. Is there any discussion? Is there any discussion? Seeing none, we'll proceed to vote, and I'll ask the clerk to do roll call once again.
Beestrom. Supervisor Beestrom.
Yes.
Boots.
Aye.
Bovee.
Yes.
Butke.
Aye.
Christensen. Seiler.
Aye.
Crosby.
Yes.
Drabeck.
Yes.
Durham. Pfeffrick.
Yes.
Gaber. Supervisor Gaber. Gibbs.
Yes.
Guild.
Yes.
Gums. Johnson.
Aye.
Krause. Longenhan.
Yes.
Leahy.
Yes.
Lowe.
Yes.
Mask.
Yes.
McEwen.
Yes.
Miller.
Yes.
Nutting.
Yes.
Oberbeck.
Yes.
Opal.
Aye.
Robinson.
Aye.
Rosenberg.
Aye.
Schaefer. Supervisor Schaefer. Schley. Seefelt. Supervisor Seefelt. Soibert.
Yes. Yeah.
Stark.
Yes.
Tremelling.
Yes.
Wagner. White.
Yes.
Zhang. Supervisor Zhang.
Yes. Yeah.
Zerini.
Aye.
Gaber.
Yes.
Krause. Schaefer. Seefelt.
Yes.
Oh, you're all wet. Go. I'm on a phone. Get out of here.
Please put your phone on mute, Supervisor Schaefer. That came over the radio. The motion is carried, and it is unanimous. Moving on, we will now discuss the additional issues to be voted on Tuesday. Under 9BB ordinances from Environmental Resources Committee, under 9B1A, Town of Eldron rezone, Tim Vreeland on behalf of Blake and Lacey Cherwanka, ordinance 5-20. Anybody have any questions? Anybody have any questions on that Town of Eldron rezone? Okay, moving on to 9B1B, Town of Spencer rezone, Norman and Marilis Tremelling for Larry and Clifford Eckes, 0-6- ordinance 0-6-20. Any questions? Item 9B1C, Town of Plover rezone, Jared Kautza and Gerald and Diane Resch, ordinance 0-7-20. Item 9B1D, Town of Plover rezone, Dan Higginbotham, Plover River Land Company on behalf of David and Patricia Thompson. Under 9B1E, text amendment changes to the General Code of Ordinances for Marathon County, Chapter 11.2, Animal Waste Management Ordinance, Ordinance 9-20. Any questions? Any questions? (9B2) from the Executive Committee. 9B2A, amending Section 2.05, Parent 17 of the General Code of Ordinances, Task Force on Marathon County Board Size to extend the deadline for delivery of a recommendation to December 2020. Ordinance 0-10-20. This is amending that ordinance. It had a termination date of July 31st, and now the the recommendation from the executive committee is to move that to December 31st. Any questions?
Supervisor Schaefer has a question.
Supervisor Schaefer.
I was out on December's meeting with surgery. Was there a task force appointed at that time?
No, the task force was not appointed. There was discussion at each of the executive committee meetings, and that the names have not been brought forth. There's been discussion because as it stands today, there could be as many as 14 new supervisors on the board with the election happening in April. So the executive committee has held off on the appointments, and those appointments will take place in April.
Follow-up question.
Go ahead.
Is the task force, is it the intent of the executive committee to just have the task force made up of current, at that time, county supervisors or citizens at large?
The current thought process under the is a member from each of the standing committees, plus diversity, plus being diverse, meaning rural, also urban, and they're also citizen representation, or no, just citizen engagement.
I believe that staff that we're going to have a number of public opportunities to be heard on that.
Yeah, there was not going to be citizen membership, but there was going to be multiple opportunities for citizen engagement. In fact, it calls for direct engagement with the population of Marathon County.
Okay, thank you.
Any other discussion? Questions on that amending section 2.05, parent 17? Okay, moving to resolutions. Environmental Resources Committee, on item 9C, 1A, a resolution adopting the Marathon County Solid Waste Management Board Strategic Plan, Resolution 19-20. Any questions on that? Moving on to item 9C2, Human Resources, Finance and Property Committee, Environmental Resources Committee, and Forestry and Recreation Committee. Under 9C2A, purchase of the Crees Timber LLC property for County Forest, Resolution 20-20. Item 9C4, Human Resources, Finance and Property Committee. Item 9C4A, create one FTE Assistant Corp Counsel position in the Corp Counsel's office effective April 5th, 2020. Resolution 21-20. Okay, item 9C4B, to create two full-time 1.0 FTE social service professional, social worker, children's long-term support position and amend the 2020 budget. Resolution 22-20. Item 9C4C, to create one full-time 1.0 FTE senior social service coordinator, community support specialist position, and amend the 2020 budget. Resolution 23-20. Any questions? Item 9C4D, reorganization of the Register of Deeds Office, abolish 2.0 FTE administrative assistant positions and create 1 FTE administrative specialist position. Resolution 24-20. Item 9C4E, a resolution to establish salaries for elected department heads, county clerk, register of deeds, and treasurer for the upcoming term of office. Resolution 25-20.
This is Supervisor Robinson. Quick question relative to the 3%. Is that our standard, going to be our standard for next year for all employees?
That hasn't been set yet by the Finance Committee and the parameters on the budget. But that is one of the discussion points that the Finance Committee is looking at. Any other discussion? Item 9C5 from the Executive Committee, 9C5A, a resolution approving the 2020 Administration Work Plan, Resolution 26-20. The administrator would like to give a brief announcement that the administrative work plan is in your packet. However, in the last 15 days, he has been working diligently on the COVID-19 issues. So there has been a lot of, it's very evident that the assistant administrator is needed, but to assist in getting some of these work plans moved forward. So I encourage every board member to read the work plan, look at the items on the work plan, and if there's some discussion, I have those for Tuesday. Any discussion now? Item 9C5B, a resolution to proclaim the existence of a county emergency related to COVID-19, Resolution 27-20, and that is on the agenda for action tonight. What is your questions, or what is the motion?
Move to approve, Schaefer.
Who was that that moved to approve?
Schaefer.
Supervisor Schaefer with a motion to approve. Is there a second?
Supervisor Robinson.
Supervisor Robinson with a second. Any discussion on the motion?
And on the motion, we are dealing with the Executive Committee version versus the one that was in the packet.
The updated one is currently in the packet. If people have had a chance to update their packets, the one that was approved by the Executive Committee that included your language change was uploaded earlier in the packet. So if people did an update, Supervisor Robinson, they would have had it, the updated version that does include the language that you alluded to earlier. An Executive Committee took action on. So the supervisor aware, it's the third, be it further resolved, the head of the emergency management of the county is authorized and directed to carry out his duties under Marathon County's Emergency Operation Plan. The Executive Committee included this sentence, including the application for grant funding and reimbursement from federal government, state government, and other agencies under the supervision, that is already still there, under the supervision and the direction of the county administrator, and perform such other duties as may be directed by further resolution of the board. So that was if you are still looking at the old version, that was the change that was made by the executive committee. Any further discussion? Any further discussion? All right, I will ask the clerk to call the roll one last time.
Beestrom.
Yes.
Boots.
Aye.
Bovee.
Yes.
Butke.
Aye.
Seiler.
Aye.
Crosby.
Yes.
Drabeck.
Yes.
Durham. Yes. Fifrick.
Yes.
Gaber. Gibbs.
Aye.
Guild.
Aye.
Johnson.
Aye.
Krause. Supervisor Krause. Longenhan.
Yes.
Leahy.
Yes.
Lowe.
Yes.
Mask.
Yes.
McEwen.
Yes.
Miller.
Yes.
Nutting.
Yes.
Oberbeck.
Yes.
Opal.
Aye.
Robinson.
Aye.
Rosenberg.
Aye.
Schaefer.
Aye.
Schley.
Aye.
Seefelt.
Aye.
Soibert.
Yes.
Stark. Supervisor Stark. Tremelling.
Yes.
Vole. White.
Yes.
Zhang.
Yes.
Zrini.
Yes.
Krause. Stark.
Yes.
All right.
And the motion passes, and it is unanimous. We move on to item number 10, announcements and/or requests. Well, any other announcements or requests? Supervisor Nutting. Supervisor Nutting is recognized for announcements and/or requests.
Thank you, Mr. Chair. I see that on their agenda for our next meeting, there are probably no less than 16 of these items that need to be approved. And I'm wondering if I could direct a question, or you could direct a question to the corporate counsel as to whether or not we might go by the approval of if you would ask if there is any negative against these, whereby that person could then voice their negative, and we wouldn't have to read through all potential 38 names, and that could speed things up. If you could ask that for corporal counsel.
We'll work on improving and speeding up the voting process. Any other discussion? If the rest of the board did not hear that, Supervisor Nutting asked the question whether or not there could be a request for anybody voting in the negative, and if there was not, then it would by default be the other. We will, with Corp Counsel and the chair, we will take and look at that issue. Any other announcements and/or requests?
Mr. Chair, this is Supervisor Drabeck.
Supervisor Drabeck is recognized.
Yes, thank you very much. I got a thank you note from Heather Hoyt here, who just wanted to let everybody know that thank you for helping with the Frontier problem and doing the best we can. She knows it's not an easy fix, but just wanted to let everybody know, thank you, that was working on it. So that's what I got.
All right, anybody else under announcements and or requests? Seeing none, I'll declare this meeting adjourned, and we'll see everyone on Tuesday, and we will try to work out some and improve as we can in these times. Thank you.